PRRS is still the main challenge on our farms. When you think you've got PRRS under control, you have PRRS again. So, the fight goes on, and we keep standing by your side, as we have done for 10 years now. We have sold 215 million doses, with a supply guarantee over these last 10 years. We have demonstrated protection against highly pathogenic strains, and our hypodermic needle-free device represents a step forward in intradermal vaccination against PRRS. The fight against PRRS goes on, as does our commitment.
Good morning. I'm very happy to stay with you again today, talking about acclimatization of gilts. For me, one of the most important challenges that we have in the farm. One of the reasons of that is because I am absolutely obsessed with the retention rate. You know that retention rate is the percentage of gilts that we are going to maintain in the farm in the third farwin. The retention rate should be 70%. The meaning of that is that we don't have to lose more than 15% of gilts in the parity 1 and in the parity 2. And this is a very, very huge challenge due to different reasons. So let's go to see some key points that I consider important, at least to think about them. First, we are going to talk a little bit about the body conditions. So here you are in this slide for the target that we have in the farm in order of weight and other characteristics of the gilts at the first insemination. I am absolutely sure that you recognize that because is the recommendation of the most of the commercial genetic, and also you can find this data in the bibliography. So these 4 points are very, very important, of course, yes, but under my opinion, there is another 2 ones that they are very, very important, that is loss muscle during the first gestation and weight loss during the first lactation. And this is important because of usually we thought that the acclimatization of the gilt ends just after the first insemination, and it's not. During the first year of the gilt in the farm, many things is going to happen. Of course, it doesn't make sense that a gilt who is continuous growth during the first year and have inside 15, 16 or more piglets, and later he has to win 14, 13 piglets. It's very, very important to try to maintain this body condition, not only thinking at the first insemination, but also think in lost muscles and weight loss during the first lactation. But we know that data, but at the end of the day, we are doing something wrong, because of when we analyze, in that case, the removal in the farm by parities, we can see how in the first parities, the mainly cause are the reproductive failure, but this is directly in relation with the acclimatization of our gilts. But not only the elimination of the animal, also in the mortality. When we check by parity the mortality in different farms, we can see how the most percentage are in the parity 1 and parity 2. In parity 2, in most of the cases, due to bad body conditions, and in parity 1, both bad body conditions and poor health adaptation. So in order to try to give an answer for these two slides, the last year we took 160 gilts, 1 weekly batch in a farm, and we tried to see what is happening in relation with the first weight, with the weight in the first insemination. And what we had was that, of course, all of on average, the average was inside of the target, but we have a very, very huge variability in the weight of the gills in the first insemination. As you can see here, almost 30% of them are under the target, and almost 30% of them are out of the target. At the end of the day, 20% of the animals are inseminated out of the target. And the reason of this is because of, if we have the gilts in a libitum feeding system between the 6 and 7 months, we are going to have this high variability, because the feeding intake is very variable in the group, and at the end of the day, the everyday gallons is very, very variable. Also, we can find some gilts that are able to grow more than 1 kilogram per day, and that is totally crazy. So we have to try to improve this, of course. The other thing that we see many variables, but like we are going to see later. But at the end of the day, if you want to have this homogeneous gilts, there is only one way: is to try to control the feeding intake from the 6 months in ahead. Of course, in the most of the farms, we can do that, like in this one with this electronic feeding system. But at the end of the day, you can try to find some other options. Like for instance, in that farms that we take the gilts with 7 months, they are feeding at libitum between 6 and 7 months. But later, when we move these gilts to stalls with 7 months, we are split in 3 different groups, only doing by the weight. It's a visual split. So the big ones animals we inseminate just in the first heat after the 7 months. The medium of them we wait for the second, or perhaps we inseminate in the first, depending on the target that we have in that moment in the farm. And for sure, the small ones we have to wait 2 or 3 parities after to put them in the stalls. Of course, during the 6 and 7 months, you have to exposure with high intensity with a TC bore, and you have to control the heats. So it's not. This is not. I don't say that we are inseminate the animals in the first cycle. Not. So we have to wait at least to second or third cycle for the insemination, because of, as you know, in the first cycle, the ovulation rate is very, very poor. So later we are going to see how to do this diagnosis between puberty and non-puberty animal in a very simple way, who is the ultrasound. At the beginning, I was telling you how important it is not to lose muscle during the first gestation, and it was a very surprise for us, because of at the end we have 25% of the gills who is losing muscles during the late gestation, and it doesn't make sense, because of at the end of the day there is continuing growth. They have more and more piglets inside with more weight, so they are wing weight. And at the same time, they are losing muscle, so it doesn't make sense. We have to do something in relation with that. And later, when we check the total born piglets, we can see how there is a relationship between the number of piglets at the first farrowing with the muscle lost during the gestation. So for sure, we have to do something in relation with that. Nowadays, what we are doing is to try to split in 2 groups the animal, and if it's possible, give them other nutritional feeding in order to achieve this point. Let's go to move to see how to do this diagnosis of the puberty by ultrasound. As I said, it's very, very important to control the first cycle of our gilts. And something that we do in the farms is between 6 and 7 months, we work a lot with a TC board, and we try to see how many of these animals are also get an estrus or how many of them not. But with this percentage of animals who don't show an estrus, then we check by ultrasound. This is because of we have seen this variable between weights, but this variability, we are going to have this variability also in the puberty because of we are thinking that the puberty comes between 6 and 7 months, but not always happen in this. In this particular study, I check all the gilts during 1 year in a farm, and I check by ultrasound more or less with 7 months, and you can see here like 80% of our girls with 7 months never saw as an estrus, and the diagnosis by ultrasound was no puberty animal. The consequences of that is that most of these girls are going to be inseminated in the first cycle, and for sure the total borns in this particular animal and in general in the farm is going to be poor. So let's go to see how to do this diagnosis. Basically, the diagnosis for puberty or non-puberty is based on the size of the uterus. Here you are, the non-puberty uterus, very small uterus, more or less from one ovary to another one. The size of the uterus could have around 50 centimeters, 60 in the most of the cases. But the situation changed. The size changed completely after 2 or 3 cycles, like in this example. This is the uterus of a 3-cycle gilt, that from this ovary to this another one, perhaps we have 1.5 meters or more. So we have to use this difference in the size to try to determine the puberty by ultrasound. Here I am. I'm going to explain you a little bit the technique that is a little bit different. The ultrasound is a commercial ultrasound, the ultrasound that you can have in your farm, so it's not a very expensive ultrasound. This is the typical machine who costs around 1,500 euros or something like that. And as you can see, my proof is completely perpendicular to the floor, and I try to put the proof behind of the leg, and I go with the proof up to see the bladder. That is very, very easy to see the bladder, as you know, by ultrasound, because this is a very anechogenic image, as we are going to see now. But the technical at the end is not very difficult. A little bit different of the technical with the pregnant sows, but it's not very difficult, as you can see. Later in the image, we have 3 different structures. The bladder in one hand, the uterus, and the digestive tract. And it's very, very easy to see the bladder. As you can see in this image, the bladder is on the top because it's completely black. Later, we have this very small uterus. In the most of the cases, is behind of the bladder. I am going to explain you how to see the uterus in the most of the cases, and compare this small uterus that we have here. I put it again in comparison with puberty animals who has a very, very big uterus. So it's very, very easy to recognize the puberty or non-puberty of this animal with this technique. So to see the difference between the uterus and the digestive, only you have to see this white line that we have here. This is or this another one. You can see this white line. This is a hyperechogenic line due to the gas. The gas is not possible for ultrasound, and they give us this white line to split the image in 2 parts, uterus and digestive tract. So it's very difficult. It's very easy to distinguish at the end in the field. So again, you can see how easy it is to do this diagnosis, and very useful in the farms at the end. Of course, you don't have to check the 100 of gilts. It's not necessary. You have to work with the TC board to detect the estrus, and of course, if you detect the estrus in one particular gilt, that gilt is on puberty for sure. But you have to try to check only these 10–15% of these gilts that nobody in the farm check or see an estrus. If you want more information about that, we did this publication a couple of years ago to describe better the technique. So let's go to the last point. For me, this is the most difficult point that in order to have good results in acclimatation, because of with body conditions, with other, if we want, we can do it. But with acclimatations, in many occasions, happens that the things that we want to happen never happen, and on the contrary, the things that happen, and in the most of the cases, we don't want to happen. So, only to remember the general objectives that we can have for the sanitary adaptation is this one: so prepare and introduce gilts that are immune to the main diseases existing on the farm without them becoming infection for the breeding herd, and very, very important also for their offspring, because sometimes we forget this part, and this is very important, for instance, for Mycoplasma, pneumonia, and others. For birds, of course, it is too, but we have to consider these points. So what is our protocols to try to do that? Okay, we have these 3 steps always: the sanitary control, acclimatization, and monitoring. Sanitary control is usually too easy to do and to understand, is to try to know the status of the gilts that we are receive in our farms. It's easy. Acclimatization is do something to try to adapt the health status of the gilts to our status in the farm. That this is relatively difficult to do this. There are different tools that we can use in the farm. Later we are going to see. And the third, but very, very important point is monitoring after the acclimatization, because in most of the cases we forget this part. Some of them we do the first. In the most of the cases we do the second point, but the third point, in the most of the cases we forget it. We don't do it in every single batch. But the target in that case is to know the new status of our gilts. Second point is to evaluate the acclimatization program for every single disease that we have, to understand if what we are doing in the farm is working or not. And the third and very important point, and sometimes very difficult, is to reduce the risks to introduce this animal setting in that particular case, PIRS, for instance, on other diseases. So this is the three steps. Let's go to the first one. The first thing that we have to understand is to try to see, or let's go to see a review, how can be the farm who proceed the origin of the gilts and the farm that we have. So there are different status of the farms, as you can know. Suppose that are negative for all. Always they have a seronegative for ELISA in different samples moments. Provisionally negative. This is reference to these particular farms who are in the eradication moment, or just after the eradication. So with high probability we are going to have seropositive cells in the farm, but for sure they are negative for PCR, and the replacement gilts are negative 60 days after of entry in the farm. A stable positive is when we don't have in the farm clinical signs, no lesions. We have, of course, seropositive sows, but we have PCR negative in piglets in at least 4 consecutive batches. In that particular case, with a prevalence of 10%. And the last one is unstable positive. We have the seropositive, for sure, seropositive in sows, and PCR positive in piglets at birth or at wean. So understanding this 4 possibility, then our control at when we receive the gilts must to be a little bit different. For instance, if the farm of origin is negative and our farm is also negative, we have to try to improve the number of samples. So we have to think in lower prevalence in that particular case, 5% of prevalence or less. But thinking in 5% of the prevalence, we have to take 60 blood samples from the gilts. We have to run a PCR in pulses. You can do it in pulse or in oral fluids, and repeat 15 days later the serology, thinking that there is a possibility that these particular gilts be infected during the transport. The target is that, of course, always the result had to be negative. If the farm in origin is negative, but we have a positive, it's more or less the same because we have to be sure that we don't have a new strain of virus in the gilts that we are going to receive. So more or less the samples are going to be similar, but in this particular case, in the most of situations, in this destination farm, we are initiated the vaccination program. So we have to consider that 7 days after the vaccination, we can have positive animals in the samples. So we have to consider this. So if we do, or if we don't run a PCR, we can do. We can check the strain virus to see, with sequencing, to see if we have a new virus, the virus that we have in the farm, or the virus of the vaccines. And the third situation is that the farm is positive and the destination is positive. So in this particular case, it's not a good idea to introduce positive gilts from one system that is a no for us. So we can do this if we know how is the situation in the batch of origin, the strain, the prevalence, the situation with respect to the stability there, but for sure it's not a good idea to introduce positive animals in an unknown origin. So in this particular case, you can reduce the number of samples because of the prevalence. It's not necessary to go to 5% of prevalence. You can go to 10% of them. So with 10% of them, you have to take 30 samples. And it's important to run PCR to see if the virus is or not the same that you expected. But the recommendations should be that the replacement must be negative in the most of the cases, if we can't, but if we can do it, better negative, especially inadequate acclimatization area is not available in the farm. So this third insemination, you have a little risk that some particular animal are setting the virus, and if you don't have a good place in the farm to monitoring this, you can have problems later with the others. And if it's possible, enter the replacement so that at least 2 months from the entry to put these gilts in contact with another ones. 2 months nowadays for this is the minimum time that we need it, but we are seeing now, at least in Spain, with this high virulent virus, is that we need more time because they are setting the virus for a long time, more than 2 months. So nowadays, at least in Spain, if we can, in the farms, we introduce the gilts younger than in the past, and at least we give 3 or better 4 months in order to improve this point. With respect to the vaccination, there are 2 possibilities, but the primary vaccination, especially when you have negative animals, for sure you have to use a live adenoma vaccines. As everybody knows that, and later you can use 2 possibilities for booster, maintain these live vaccines or use these inactivated vaccines. The other thing that we are doing is exposition with mainly with sick piglets, because of we take sick piglets from the nursery in the most of the cases, and we put in contact these sick piglets with our gilts, usually after the first vaccination, in order to try to reduce a little bit the symptoms in gilts, because of if you don't do that, perhaps you have a high levels of or high percentage of mortality in gilts. But I recommend to you the sick piglets or some material. For instance, yesterday I was talking about tongues. Tongues of could be a good material also, but we have to take care with other materials like placenta, lungs, and other ones that can have another important pathogens that perhaps in that moment is not of our interest to put in contact with them. So sick piglets could be a good idea, but you have to consider that in this particular moment when you put in contact these animals, this area is a very high risk area. So it's much better if this area is out a little bit far away from the farm, and you have to try to improve some measures in order to go there with a little bit of security. For pairs, you have to consider the duration of the viremia also, and depending on when you are going to infect your animals, the duration of viremia changes a little bit, as younger as most duration of the viremia you are going to have. So you have to take these considerations. And during the exposure, you have to consider the administration of some antimicrobials due to secondary infection that you can have in that moment. And for sure, you have to consider that if you don't have a good area in the farms, perhaps it's a better idea that the workers who go there goes to the end of the day and not go there first and they after go to the farm. So, with respect to the vaccination, it's important, but we have to consider another important tools, another important things that are first of all, that we have to calculate previously what the replacement we are going to need, but not only in a short period of time. It's much better to think in long or medium period of times. So, as I said, we have to put all these animals in a clean and disinfected area, but it's not to be in contact with a farm production animal. You have to consider this acclimatization zone like a highest risk zone. I talked about this. So yesterday we have a very good lecture talking about the biosecurity, and this area is one important area in order to improve this. So during the sanitary adaptation phase, the work on these skills will come carried out at the end of the day, as I said now. And only to remember what we can have with the vaccines. The vaccine is going to reduce the abortions, the clinical symptoms, the lesions, and the lesion due to concomitants, but it's not to prevent us of the infection, it's not eradicate the infection, is not a substitute for biosecurity. This is very, very important, and is not a substitute for management measures. So, in conclusion, the body assessment, the feeding intake control from 6 months is very, very important. It's just at the beginning of my lecture, we talk about this. Very, very important not to have ad libitum feed intake, and we have to take to control this from 6 months in ahead. The adaptation does not after the first insemination. We have to think that the adaptation lasts at least during the first year of life. With respect to reproductive management, talking about puberty, the insemination in first reproductive cycle is very, very poor results. Remember that the first cycle has a very, very poor ovulation rate, and the ultrasound puberty diagnosis is a well-demonstrated tool to improve our reproductivity. And with respect to the sanitary adaptation to PIRS, so there are these 3 important points: control, acclimatization, and monitoring. And vaccination is a safe and effective measure to PIRS control, we see. And exposure needs to specific facilities and management. Remember that the biosecurity and well-studied replacement strategies are also needed. And this is everything for me, so I appreciate your question later. Thank you very much.